with the name of Allah, who is the most merciful and the most beneficent. Assalamu alaikum. Welcome to my channel, The Smile Squad. In this video, we will learn about the different blocks used in the mandible. We will learn about long buccal nerve. The long buccal nerve is the branch of the mandibular nerve, which is one of the three main branches of the trigeminal nerve. The long buccal nerve runs through the buccal mucosa and provides sensation to the cheek and the buccal gingiva. Long buccal nerve block. The long buccal nerve block numbs the buccal mucosa, the lining of the cheek, and the buccal gingiva, the gums on the cheek side of the teeth. The areas anesthetized by the long buccal nerve block are buccal mucosa and the skin of the cheek, as you can see in the picture. The nerves anesthetized by the long buccal nerve block is the long buccal nerve. It is the branch of the mandibular division of the trigeminal nerve. The long buccal nerve block is used for biopsies or surgical procedures on the buccal mucosa near the mandibular molars, or surgical extractions of molars when the buccal soft tissues needs to be reflected. Long buccal nerve block is contraindicated in patients with a history of allergy to the local anesthetics. Maybe some patient can have allergy to the lidocaine or articaine. Patients with certain medical conditions such as bleeding disorders or severe cardiovascular diseases. Bleeding disorders as hemophilia or hematoma formation at the injection site. When a patient is given a local anesthetic and the patient is suffering from cardiovascular diseases, it can cause changes in the blood pressure of the patient due to the vasoconstrictors present in the local anesthetics. Patients taking certain medications such as anticoagulants or MOIs. MOIs means monoamine oxidase inhibitor. It is used to treat the depressions. When the local anesthetics are used with the patients taking monoamine oxidase inhibitors, it can lead to the adverse reactions. The advantages of the long buccal nerve block are: it can be used for the variety of dental procedures, it is easy to administer, and it is effective anesthesia for buccal mucosa, skin of the cheeks. The disadvantages of the long buccal nerve block are: it can cause paresthesia. Paresthesia is the abnormal sensation as numbness, tingling, burning, or prickling. It is caused due to the nerve damage. It can cause hematoma due to the vessel damage. It may not provide adequate anesthesia for lingual soft tissues or pulpal structures. Requires separate injections for full quadrant anesthesia. The alternatives used for the buccal nerve block are infiltration anesthesia and the nerve blocks of the adjacent nerves such as the inferior alveolar nerve or the lingual nerve. The target area for the long buccal nerve block is the long buccal nerve, which is located in the buccal mucosa. Landmarks. The landmarks used to locate the long buccal nerve include the buccal mucosa, the anterior border of the ramus of the mandible, and the external oblique ridge. The technique for administering the long buccal nerve block is advance parallel to the occlusal level and inject above the external oblique ridge. As the needle hits the bone, withdraw slightly and deposit the local anesthesia. The area of insertion for the long buccal nerve is the buccal mucosa. Precautions that should be taken when administering the long buccal nerve block include using the sterile needle and syringe, monitoring the patient's vital signs, and avoiding the intravascular injection. The onset and duration of the local anesthesia for the long nerve block is: the onset is within 1 to 2 minutes and the duration is around about 20 to 40 minutes of soft tissues anesthesia. Signs and symptoms of successful anesthesia include numbness or tingling in the buccal mucosa, skin of the cheek, and loss of sensation in the buccal mucosa and skin of the cheek. The failure of anesthesia is due to the incorrect needle placement, insufficient anesthetic solution, anatomical variations, or premature contact with the bone. Accessory innervation to the buccal mucosa, skin of the cheek, can be from inferior alveolar nerve, the lingual nerve, and the auriculotemporal nerve. The inferior alveolar nerve provides sensation to the lower teeth and surrounding tissues. The lingual nerve provides sensation to the anterior two-thirds of the tongue, and the auriculotemporal nerve provides sensation to the temporomandibular joint and surrounding area.